Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes, and today we are doing how to do speaking in OET and why. Normally there you would see a lot of results, people sometimes scoring 330 in speaking, 340 in speaking, and I always say there is no difference. There is no difference in 330 or 340. The difference is of margins. So some people feel that maybe it can be due to grammar, it can be due to this, it can be due to that. So I'm just going to cover every aspect, whatever is possible, to make it sure that you learn everything about speaking. But before that, please subscribe our channel if you have not. And our contact number is 76967342256. So let me talk about OET speaking today. So OET speaking, as most of the times people pass in OET speaking, but sometimes a lot of people struggle with it. So I'm just going to take 10-15 minutes to cover everything about OET speaking. First of all, in OET speaking, you will get a role play where you get every instruction. So you don't have to speak anything apart from the role play. That means do not add your points, because sometimes you add your points and that leads to complication, that leads to fumbles. So that is the first instruction that I would like to say: don't add anything from your side. So keep on add lines, that don't worry, you will be fine. But as far as the information is given, medical information is not required to be added. So sometimes you add medical information. Like I remember when I was new to this thing, I'm talking about 10 years ago. So there was a student. What she did is basically she spoke a word hydrotherapy. There was nothing that was given like a hydrotherapy, but she said hydrotherapy should be given, or hydrotherapy should be taken. Then examiner, the interlocutor, asked, what is hydrotherapy? By chance, it was a moment of flow. Normally, examiners do not do that. They are very, very reluctant. So by chance, examiner said, what is hydrotherapy? So she fumbled and she failed. So that is what I want to say. It is very important when it comes to OET, do not speak anything extra. This is the most important instruction that I would like to give you. Never in OET speaking. But if by chance there is anything that you do not know, because there is no marks for information in OET. So by chance, if somebody says, what is hydrotherapy? So you say, don't worry, I will fix your appointment with the physiotherapist. She will come soon and she will explain you everything about hydrotherapy, or he will explain you everything about hydrotherapy. Means anything that you do not know in OET, or OET as far as the medical information is concerned, put it on the doctor, put it on the physiotherapist. Means to the person, suppose if somebody says, I'm having a toothache and the tooth is A2, so you say, don't worry, I will fix your appointment with the dentist. He will tell you everything about this problem. So if something is given in the role play, please cover that thing only. Do not cover anything extra. The first and the most important instruction. Suppose if somebody says, oh nurse, I took amoxicillin and doctor told me this and that, but by chance I had some side effects, I don't know which medication should I take. If the medication is given, then you talk about it. Otherwise say, don't worry, I will fix your appointment with the doctor. Doctor will come soon and he will tell you everything about the medication. He will discuss with you other options, and also he will change the medications if required. So you don't take any initiative of changing the medications or being a nurse if anything is not given. So always, this is the biggest solace or relief, that anything you do not know, if examiner tries to trouble you, you say, don't worry, I will fix your appointment with the doctor. He will come soon and he will help you with this thing. So this is the first and the foremost instruction that I want to give you for OET speaking to avoid fumbles. Second instruction, again, each and every instruction today I will discuss would be very, very important. So please do not ignore any instruction. Second, including subscribing our channel, even that is very important. I'm just kidding, sorry. So reluctant. Examiner can be highly reluctant if the task is okay, and if the patient doesn't have to be aggressive. Some task is like patient needs to be aggressive, so examiner will be, oh nurse, what you did with me, oh doctor, what you did with me, you gave me the medication, now I'm having severe side effects because of the medication. So he tries to scare you. So the best word, you say, calm down and relax. First of all, let me explain you this and that happened. So when patient is angry, so calm down is the word. Please calm down, don't worry, I will fix up everything. Let me explain you what happened is. So you explain the things, this and that happened, so it is not our fault. In medical profession, sometimes medication do have side effects. And also when we collected your past history, we asked you that if you are reactive to any medication. At that time you said that you are not reactive. That means nobody knew that you are going to be allergic to this medication. So sometimes medications are allergic to particular patients, to some particular patients. So it happened in your case. We are really sorry for that. We apologize. But at the same time, now we will change your medications. So are you understanding my point? So always explain. And common line like these are very important. Always ask the patient after like 1 minute or so, 2 minutes or so, are you understanding my point? You can ask this, but you do not ask this again and again. So you keep on changing. Are you understanding my point? The next times you say, are you getting me? Next time you say, is it clear? Should I repeat anything? So these are the lines, common lines. You keep on building the momentum. You cannot stop, because again, OET speaking is recorded in the audio form. When I am talking to you, you can see me. So even if I fumble, it will not cause too much of trouble. But when it comes to OET speaking, it is audio recorded. So suppose if I close my video now, so everything is dependent upon my voice. So my voice should be very fluent, very clear, and the instruction should be complete. So that means now it is all matter of voice, that I have to speak very carefully, very nicely. I should be very audible. It should not be too loud. It should not be less loud. It should be fluent. And also the way I am speaking right now, you should habit of speaking for 5 minutes, because the second thing I was saying, apart from the angry task, the patient will be reluctant. He might not speak even two total lines. So you have to carry your task for 5 minutes, like the way I'm speaking to you right now. It has been almost 2 3 minutes, but I do not get, I do not stop myself. Like this fumble which I did just now, when I changed my line, these fumbles are common because we are humans. So don't worry about these small fumbles. I'm talking about bigger ones, that you take a pause of 10 seconds, then you are in trouble. 10 seconds is a very big pause. So if by chance I'm pausing now for a second or two, it is fine. This pause is not a problem. Like I'm speaking to you right now and I'm taking the pause and now I'm speaking, it is not a problem. The problem is that when I say, oh, don't worry, let me explain you this. Now this is a big pause. This kind of pauses, leads to deduction of marks. Not necessarily fail you, but will lead to deduction of marks. So we should avoid these things. So first you will say, and common like this, are you understanding my point? Are you getting me? And take the name of the patient if you have asked for the name in the start. So are you getting me, Mr. John? Is it clear, Mr. John? Or should I repeat anything? So lines like this will give you more marks, because you're taking the name of the patient. That means you are connecting to the patient. Or should I repeat anything? Sometimes people do not, or candidates do not ask these questions. That can also be the reason of sometimes getting 330, 340, because it is very important. You can't speak continuously. Like I'm talking to you right now, because I have put you on mute. Otherwise, if I'm taking your speaking, I would like to ask you guys, are you understanding until now? Should I repeat anything? Like, let me do it naturally. I will unmute you. Please keep your mics on mute and speak whose voice is clear, because we are recording it. So is it clear to everyone? Should I repeat anything?
No, sir, it's clear.
All right. So that is what
It's
we
not
say.
clear.
And then you say, all right, then Mr. John, let me explain you the next point. So as soon as you ask that, okay, are you getting me? Are you understanding me? Are you following me? This is also a thing you can say. Are you following me? Is it all clear, Mr. John? Should I repeat anything for you? Okay, then, Mr. John, now taking you to the next point, which is how to take the medications, which is the side effects of the medication, that you don't have to take the medications in excess. Please take the medications according to what doctor has recommended, because if you will take extra medication, these can lead to side effects. And the most important thing, again, there can be many problems. You can never catch the problem. So you have to be aware. You cannot scare the patient. Suppose even if it is given, you are at the end stage. Well, I'm really sorry to tell you today that your reports are here. And according to your reports, you are having end stage cancer, end stage disease, and I'm really afraid to say that you cannot be treated. If it is given in the task, then you talk about these things. Otherwise, you never say these words. Oh my God, this is a serious concern. Don't use this language. You are scaring the patient. Like today, I got the mock test that is taken in the Mohali Institute. I got the reports. So everybody tries to scare you. So I could see the marks are 10 or 20 less. So I told my teachers or mentors the next time you should give 10, 20 extra points, because you need to give confidence to your people. You don't want to scare them. In the same way, today's world is very, very, kind of a world where people do not like to hear negative things about themselves. So even patient doesn't want to hear anything negative. So if it is given in the task, he's end stage patient only, then you say. Otherwise, you say, I'm really sorry to say, and you do not make your voice the way. Last time I spoke, I made my voice slow. You don't have to make your voice slow. You have to act like professional. Well, Mr. John, your reports are here. According to your reports, you are suffering from end stage cancer. And I'm really sorry to inform you, but that is what report says. So, nurse, what will happen to me? I understand, Mr. John, it is a tough time for you, but what I will do, I will give you all the instructions that doctor has given me, and we will try to treat your cancer. But nurse, you just said it is an end stage. Yes, it is an end stage cancer, but treatment is very important, because if you will not take the treatment, you may have more pain. Your condition can get worse. So please try and understand, Mr. John, that treatment is very important for you. But nurse, what is the benefit of treatment? I will die anyhow. Now you are saying end stage. So I will die anyhow. See, I agree, Mr. John. And, I know you are going through a very bad phase, but please understand, if you will not take the treatment, your pain will become worse. You will have more sufferings, which is not good. So to avoid these sufferings and to avoid the pain, medications are very important, and also they will give you a better and a long life as compared to if you do not take medications. So your lifespan will also improve with the help of medications, and also your condition would be better managed. At least your symptoms would be better managed by taking the medication. So these kind of tasks can come, and even in this time it can come, because these are difficult tasks. So it comes on, it gets on repeating that, handling end stage patients and stuff. And these are the most difficult tasks in OET, because the rest is simple. And so first, do not add anything from your side. Do not make him negative. Oh, it's a very serious concern. Why did you do that? Why don't you take care of yourself? Don't say like this. It's not good. So you say, please understand, Mr. John, it is very important to take care of yourself. So you say positive affirmations to the patient, so that patient can, you are giving solution to the patient. You are not saying, oh my God, it's problematic. Oh, what did you do? Oh my God, you are having psoriasis. So they will not pass you that way. So it is important to be positive, to tell the solutions to the patient, and then saying, are you understanding my point? Are you getting my point? Are you following me? Is it clear to you? Should I repeat anything for you? So you keep on maneuvering these lines. Other lines are also there, like, is it all right, Mr. John? Should I go forward? So going on to the next point, or going on to the next point, which is the treatment part. So should I tell you that, which is treatment part? So should I do that? Should I start telling you about treatment? So small fumbles like this is not a problem. So don't get over scared or over worried if you have bit of fumbles like this. Small fumbles are, obviously, we are humans, we are not computers, we can't speak like robotics. So sometimes people get scared, and you try to judge yourself that, I've got so many fumbles. Oh my God. This is okay. We are humans, but not too many fumbles. And at the same time, your voice should be clear. It should be loud, not too loud, not over loud. It should be clear, loud, audible, the way it is right now with me. And do not add anything extra, because sometimes you add anything extra and at that time you fumble. That is the also one of the major reasons of failures in OET speaking with good students, that good students try to over explain tasks. Don't do that. So you stick to your things, you paraphrase your task, don't add too much of information, rather avoid adding any information. If by chance examiner catches you with something, you say, don't worry, doctor will come and he will explain you everything. Third, so all these things, asking questions is a very important part, if or taking consent. So, Mr. John, do I have your consent to give you the treatment? If there is any point that is talking about science means elevated temperature or something. So you should always ask, can I examine you? And then you say, let me speak in the way. Can I examine you? All right. So after your examination, Mr. John, I have found that you are having this and this problem. This line also you should remember. Can I examine you? After, okay, that's the pose. Can I examine you, Mr. John? Yes, nurse. Okay, thank you for giving me the consent. Let me examine you now. Okay, so after examination, I have found that you are having this and this problem. So that is how you speak. So please pause it and listen to this thing again. So, can I examine you, Mr. John? Okay, nurse. Yes, you can. Well, thank you for giving me consent. Let me examine you. Okay, after examination, I have found, Mr. John, that you are having this and this problem. After examination, I have found, present perfect tense. So these are the common things. Asking questions, do you smoke? Do is a very common way of asking question. Do you smoke? Do you drink? Do you exercise? But again, you can't say it again and again. Do you smoke? Okay. Do you drink? Do you exercise? So you're not making variations, but you can so. Okay. So do you smoke? Yes. Okay. In that case, I would like to ask you, how many cigarettes do you smoke? Okay. Do you drink? Yes, nurse. Okay. How much do you drink? All right. I'm noting down this information. So this line can also help. I'm noting down this information. Okay. So now the next question is, do you go for exercise? Okay. How many times? Like morning or evening? All right. Okay. So I've noted this, all these things. So that is how you keep on engaging the patient, talking with the patient, and giving solutions to the patient. And also the most important way to improve speaking is to talk in English. And in final OET exam, you will get two role plays, and you will get 3 minutes to prepare the task. So 3 minutes you can read the task. You can write anything on the task. You can write anything on the paper. That is not a problem. So you have 3 minutes, write anything on the paper. Use that paper because there is no marks for the facial gesture. So speak, keep paper in front of you. Sometimes you can look down, or even you can take the whole speaking looking down only. So you don't have to even see to the examiner. Just voice should be clear. Voice is the thing that would be recorded. So that is the most important instruction about OET. Last but not the least, summarizing the task is very important. So now, Mr. John, I would like to summarize the whole conversation, which is that you should do this thing. This is very important for you, and this thing will play a good role, a great role in your speedy recovery. I hope you will follow these points. Yes, nurse. Okay, that's great, Mr. John. See you next time. And now, if the patient is having an acute disease, he is fine now. So, being a nurse or a doctor, we never say, patient, see you next time. Means if he's coming for a follow-up, or he has to come for a follow-up, then I say, okay, Mr. John, see you next time. I hope you would be better. But otherwise, normally doctor and nurse should never say no. It doesn't look nice. Okay, Mr. John, see you again. Take care. So you don't say see you again in terms of our medical profession. It doesn't. So small line like these, you have to be logical, and you have to be really understanding about these things, and that's pretty much about speaking. So this is it, and won't take more than this time regarding the speaking. I wanted to do a role play, but again, if you will follow these instructions, we will do role play on Monday or maybe some other day, as I wanted to do something other than speaking as well. So try to cover this task. Please subscribe our channel if you have not. Our contact number is 76967342256. This is Dr. Bhupesh from Dr. BKM Institute, assuring you for the best of the best sample videos on this channel. Thank you very much, and please share it with your friends. Sometimes we do not share it with your friends because we think he or she will pass, but we should definitely share it with our friends, because then your friend will discuss with you. But if your friend sends you video, I should not say it, but trust me, if you are taking coaching from Dr. BKM Institutes, or if you are listening to our videos, you don't have to listen to video of any other channel. Being the oldest institute of OET and the only institute run by doctors, I can assure you, because sometimes you mix up the information, you get wrong information from some YouTube channel, and then it becomes a hectic task. And sometimes people who are teaching you are not medical professionals, that causes another trouble. So please, if you are subscribing our channel, watching our videos, you don't have to worry about anything else. I assure you, for the best of the best services. Thank you.